Doctor, we have several questions on the medication Accutane. So let's start with the first one with Riley. Came across information online and that she's not sure is true. So this is what she wrote. I came across information online that talked about Accutane like it's a very dangerous chemotherapy drug causing permanent side effects, including premature aging. I would like to know if this is true. Thank you, Riley. That's a great question. Doctor?
So that question has a lot of components to it that have to be answered. So first of all, it is not a chemotherapy drug, and it is not anything like a chemotherapy drug. Chemotherapy drugs, the old type of chemotherapy drugs, were basically a type of poison that kills the cancer more than it kills normal skin. But it has an effect on normal skin or on the body, which is why it's called chemotherapy in terms of the effects that it has. So Accutane is not a chemotherapy drug at all. Okay, that's number one. Number two, is it a dangerous drug? Well, any medication is dangerous if it's not properly used and it's not properly monitored. And Accutane is one of those that can have problems if it's not properly monitored. The most important thing about Accutane is that someone cannot get pregnant while they're on Accutane. If they get pregnant when they're on Accutane, there's a very high likelihood that the baby will have some type of deformity. And therefore, that's why so many precautions have to be taken. And there's a special program called the iPledge program, which is that when an individual is put on Accutane, they have to be on this program that says that they've learned about the medication, they've learned how to be careful and protect themselves so that they don't get pregnant, and that they get regular testing for pregnancy to make sure that pregnancy doesn't accidentally occur and that the baby can be harmed. So that's why some people say it's dangerous in that sense. The other thing is, like any medication, it has side effects. If you take aspirin has a lot of side effects. Vitamins can have side effects, from allergic reactions to other things that can happen as well. Well, with Accutane, anything that can happen with any other medication can happen, like an allergic reaction. The common things that can happen with Accutane is that you can get some dryness of the skin. Your blood lipids, or that's the fat in your blood, the cholesterol, can go high. And if it gets very high, that can result in problems with inflammation in other parts of the body, like the pancreas or other things. So those are important things to monitor. The other thing with Accutane is that in some people, you can get an anemia-like picture. It can cause certain calcium deposits on the tendons and other things. So that there's a host of side effects that can occur. All of these things are usually not anything that would stop you from using it, but it does tell you an important thing, and that is Accutane is not a medication that's meant to just treat any kind of acne. It's a medication that's meant to treat acne that doesn't respond to the routine therapies like topical treatments or topical antibiotics, and sometimes even oral antibiotics. For those individuals that don't respond to those type of therapies, then Accutane is a good alternative for those individuals. But when they are on that medication, they need to be monitored carefully to make sure that they don't get a serious side effect.
And Doctor, we have a lot of your questions, and I want to hone in on one where viewers have asked a lot about irritable bowel syndrome after using Accutane. Can you talk about that?
Yes. So that one of the things that's happened with Accutane is there's two major issues with Accutane. I'll briefly mention both of them so you're aware. One is that there was a discussion of people committing suicide after using Accutane, and there have been cases that have occurred of that. But when the data was looked at in terms of whether or not the medication caused it, there was never any direct proof that that was the case. And in fact, it seems like the incidence of it was not any higher than you would expect in a population that takes that kind of medication. But because of that, everybody's always cautioned about that risk, and about the risk that if they have any psychiatric problems, they should immediately be monitored. If they have any change in mood or anything else, they should be checked. By the same token, there also had been some reports that people on Accutane developed inflammatory bowel disease or an irritable bowel syndrome. And again, the data on that is kind of unclear, whether or not that really ever happened or did not happen. Most of the data seems to point that it is not an effect of the Accutane per se. but it may have been other cofactors that people had that put them at risk for that. So the important thing is that if you're going to go on Accutane, you make sure your physician knows everything about your health and any other problems you may have, including GI symptoms and other things, so that they can properly counsel you whether you might be somebody who is at that higher risk or needs to be monitored more carefully.
And doctor, I have several questions here. So I'm going to ask my director to flatter me and kind of follow along with me, because you answered a lot of the questions, but there are still a couple of things inside each question that I want to get to. So let's get to Nancy real quick. And she says, I've struggled with acne for a long time and I'm looking into Accutane. Is it possible to ask the doctor about the rumored long-term side effects, which you just talked about, doctor? I'm most concerned with the effects of long-term eye dryness, mental effects, hair loss, and fertility hormone health. So with hers, doctor, could you take on the fertility hormone health and mental effects as well, please?
Yeah, so the mental effects is what I was talking about in terms of the suicide that had occurred with it. And again, the data doesn't seem to show that that is a direct correlation with the Accutane, but it has been reported with it, which means that you have to be monitored when that happens to make sure that if you have mood changes or anything else, you're aware of it and that you know that that risk has been reported. Again, over the years, there hasn't been a lot of data to show that that's the case, but we still monitor and we're very careful about that. As far as the fertility, Accutane doesn't affect your fertility, but what happens is that you must be on some type of birth control. Usually it'll be oral contraceptives, but you have to be on at least 2 methods of birth control. In case one fails, you have another one that can keep pregnant. So it's not that it makes you infertile, it's that we don't want you to get pregnant while you're on the medication because of the fact that the baby can be born with abnormalities. That program I mentioned, the iPledge program, when a person goes on Accutane, they are counseled about all these things, including birth control, including the issue of the mental effects, the issue of the irritable bowel or the inflammatory bowel disease effect. Everything is discussed with the patient, and they are given information to make sure that they know it and they acknowledge it, and then testing is done. So those things are all done with your doctor, and it's just a matter of having a good conversation with the doctor to make sure that's all taken care of.